Hi, Dr. Leila here, and today we are discussing abortion. Let's define what abortion is. It's a termination of pregnancy by any means before the fetus is sufficiently developed to survive on its own. Or we can define it as vaginal bleeding before viability age, that is 28 weeks of gestation. And we have different risk factors for abortion, one being age above 35 years and age below 16 years, previous miscarriage, obesity, alcohol intake, cigarette smoking, chronic illnesses like diabetes, and also abnormalities of the uterus and the cervix. Causes of abortion, they are classified into two: first trimester causes and also second trimester causes. So first trimester causes means the pregnancy is between 0 to 13 weeks, and the most common causes there are genetic causes and also hormonal causes. So under genetic causes, we have paternal chromosome abnormalities and factor V Leiden mutation, while hormonal causes, we have things like polycystic ovarian syndrome, we have luteal phase defect, we have hyperprolactinemia, and also diabetes mellitus. While second trimester causes, that is the pregnancies between 13 weeks up to 27 weeks of gestation, and we have things like Torches infection. Torches infection stands for T is toxoplasmosis, O stands for others, that syphilis and hepatitis, R stands for rubella, C stands for cytomegalovirus, HES stands for herpes simplex virus. Another cause in second trimester is cervical incompetency. We also have abnormalities of the uterus, that is either unicorn uterus or bicornate uterus. We also have things like uterine fibroids, Asherman syndrome, those are adhesions. And also we have inherited thrombophilia, and also APAS, also known as antiphospholipid antibody syndrome. The types of abortion, we have 6 types of abortion. We have threatened abortion, inevitable abortion, complete abortion, incomplete abortion, missed abortion, and septic abortion. Now let's start with threatened abortion. So here the patient usually comes with vaginal bleeding, which is usually bright red in color, and also mild to moderate abdominal cramping with the fundal height corresponding the gestation age. Fetal heart rate is usually also present, and the cervix is closed. So in this case, we do bed rest for the patient. We monitor 4 to 6 hours, and also we advise the patient to avoid strenuous exercise and also sex for 14 days. And also maybe we treat if the patient has an infection. You do urinalysis to rule out, then you discharge the patient home. So the second type is inevitable abortion. Here the patient comes presenting with vaginal bleeding, with painful abdominal cramping, and usually the cervix is opened, and the fundal height does not correspond with the gestation age, and there is no fetal heart rate. In this case, we admit the patient. So inevitable abortion, we admit the patient, we give analgesics for the pain, and also we give antibiotic where necessary, and also we do manual vacuum aspiration, that's NMVA, if the